And it was there when I saw that it had blood. For me, it was already a sure sign that I had it bad. Hello, I'm Rachel Bajamonde. I was a TB patient here at the medical city. I was diagnosed with TB in January 2019. It was just a routine checkup because I've had this cough for quite some time. I really didn't know where I got it because nobody in the house had it. Nobody in the family had it. So it was a puzzle as to how I got it. But if I will look back, then probably it got worse because I was denying myself. Because as early as November, I was already feeling that there was something wrong. I mean, I had a cough, on and off cough, fever at night. And, these are the telltale signs of having something wrong with your lungs. By January, I had to see a doctor and I was referred to Dr. Tomas.
Hello everyone, I'm Dr. Esther Fredini Manalo Tomas, an adult pulmonologist and a TB advocate. Currently, I am the section head of the pulmonary medicine of the medical city.
When Dr. Tomas saw my x-ray, there was already a spot on my lungs and it was quite big. She was so afraid that it might rupture and that I would go into sepsis.
I remember Rachel way back in 2019, a couple of months before the pandemic. She came into the emergency room and she was really critically ill at that time. Initially, we were managing her as a case of pneumonia and with uncontrolled diabetes.
I was just being admitted because of the mass on my lungs, and it was already during confinement when certain tests were done. The sputum test then revealed that it was positive for TB. When I saw that it had blood, for me it was already a sure sign that I had it bad.
Lo and behold, aside from pneumonia, she was diagnosed also with bacteriologically confirmed tuberculosis. She has a worse case of tuberculosis because it's already creating hole, in her lungs.
Dr. Tomas made it very, very clear about the treatment plan and what I will do about it, how I will go about it, and that the main thing was it wasn't going to be so expensive.
The standard treatment for tuberculosis is 6 months. Now, that's the duration of treatment. So there is an intensive phase and a maintenance phase. So during the intensive phase, like Rachel, she was given 4 kinds of drugs, during the first 2 months. And the remaining 4 months during the maintenance phase, Rachel got 2 kinds of drug components.
You know how expensive medicines are. And the fact that I get the medicines for free for the whole duration of the treatment was a great help. I knew from experience because my father was also diagnosed with TB at a latter stage, and we would buy this, I think at that time it was packed, rifampicin packs or something. It was not free at that time, so it was really costly.
The medical city has its own dots. Now it's called iDots. So we have been catering to TB cases for a long period of time. The dots gives free medicines and even helps patients and individuals come to the clinic. Even those who don't have their own doctors or pulmonologists, the dots help them out, go through diagnosis, that is through testing like sputum, and also referring them to pulmonologists at the medical city. It was somehow a long journey for Rachel because of the fact that she had a hard time dealing with the medications. At one point, she wanted to stop the medications because of all the adverse events, the side effects that she had been experiencing with the medications.
My God, the first week was really horrible. It was horrible. I wanted to quit so many times. But I have to do it for not only for me, but for my family. I have a special needs daughter during that time, I couldn't be with her. So it was something that I have to get well. They always tell me, if you give up now, you'll start again from day one. So you're just gonna be repeating the cycle. So you've already gone through so much, so why give up now? So yeah, even my daughter, when she's in the office, she would call me, Ma, it's time for your meds. Drink it na. And I mean, the constant reminders to drink it. So it helped a lot.
With all the help of her family and friends, giving her all the words of encouragement, that is really very important for TB patients. And without this, the support of family and friends, I don't think Rachel would be able, no, to go through the medication and last, no, until the completion of the treatment.
From the treatment, then on, everything, my x-ray every quarter has been very, very clear.
She has been very patient and she has been very conscientious in her follow-up. No? Unlike before, she told me that she never cared about herself until that particular day because it was a life-changing event for her because she was already critically ill.
Sputum test, there was no blood. So I knew then. Then I wasn't coughing. And then I wasn't, like grasping for breath. I could go up the stairs, down the stairs. And yeah, recently I just finished a 5-kilometer run. So I guess I'm okay.
Sometimes I think I'm also exposing myself to tuberculosis in my line of work, in our line of work as pulmonologists. But like Rachel, no? Rachel gives me that passion, that commitment, just like her. No? Because she got so committed to getting better, it makes you fulfilled in your area of expertise. So I think that's one motivation that keeps me going, even if sometimes I fear for myself getting infected, getting tuberculosis too.
It's bad getting sick, but having TB is not something that should scare away people. Once you are diagnosed and once you've reached out to the correct people, then you just have to continue the treatment. Don't stop. No matter how hard it gets, don't stop, because it's only through the treatment that you will get through it. And you will get to tell the story that TB is not something to be scared of. It's curable. The medicines is within reach, and that everybody's there out to help you. You're not alone.